Covid-19 has spread across the world, and you probably have a lot of questions about it. Like, what is Covid-19? How does it spread? And how can we keep safe?
Shumai, I'm Precious.
Hi, I'm Eleanor.
Shumai, hi, I'm Ryan.
Hi, I'm Jade.
And we're your school nurses.
Hi, I'm School Nurse Precious, and I'll start by answering what is Covid-19. Covid-19 is the proper term for what some adults around you might be calling coronavirus. It's a new type of virus, and my friends and I are going to tell you all about it. Firstly, what is a virus? A virus is a type of germ and is so teeny tiny that you need a microscope to be able to see it. Viruses come in many different shapes. The coronavirus is round and has little antennas that stick out, just like the points on a crown. This is how the coronavirus got its name, because corona means crown in Latin. A virus will try and get into a person in a number of ways. It can try through cuts in the skin, or through the mouth, through the nose, or even through the eyes. Every virus has a specific type of cell that it needs to attach to. For coronavirus, these are the cells in the lungs. When inside a host cell, the virus can make copies of itself. It makes as many as it can until the cell gets full and bursts. Then all the copies need to find their own host cell nearby to make more copies, and this is what makes you sick. Luckily, our bodies have ways to protect itself. We have special cells that battle against viruses and other germs to try to get rid of them. These cells make up our immune system. Once our immune system figures out how to beat specific germs, they can remember how to get rid of them for the next time it tries to come back. This is how immunizations work, because it uses a weakened version of a germ, so our immune system will launch a practice attack and remember how to beat that germ for real. The problem with Covid-19 is that even though it comes from the same family as other coronaviruses, our immune system doesn't know how to beat this one yet, and so it's taking our bodies longer to figure it out. And that is why a lot of people are so sick. Some people, like children, just get a little bit sick. But even if you don't feel poorly, you can still carry the virus and it can jump to other people. So let's ask Eleanor how it does that.
Hi, my name is Eleanor and I'm one of your school nurses. Today, I'm going to talk to you about how viruses are spread. As Precious has just explained, viruses are a type of germ. When they get inside your body, they can make you feel really sick or poorly. If a person who has the virus sneezes or coughs, germs that are inside their body come outside of the body. That's because sneezes and coughs can send germs into the air. When the germs go into the air, they can travel for up to 2 meters, which is further than you are tall. A healthy person might also get germs on their hands by touching somebody who's sick, or touching surfaces where germs have landed because somebody sick has sneezed or coughed or touched those surfaces. To keep germs on hands from getting inside the body, wash your hands with soap and water and use hand sanitizer afterwards. Try not to touch your mouth, eyes, face or inside your nose, because those are places where germs can get inside your body. Now let's ask Ryan to tell us about proper hand washing.
Hi, my name's Ryan and I'm one of the school nurses here in Torfaen. Keeping our hands clean has always been important, but as I'm sure you know, over the last few months there's been a lot of people telling us why washing our hands will keep us safe from Covid-19. I'm going to talk to you about why we should keep our hands clean and also when and how we do it. We just heard from school nurse Eleanor how viruses spread, and one of the ways is through touch, as viruses can live on our skin. When we have germs living on our skin, we spread them through touching surfaces, or they can enter our bodies when we touch our eyes or mouth. By washing our hands properly, we can remove viruses, germs, dirt and bacteria from our skin and reduce the possibility of becoming ill or spreading germs. To help demonstrate how germs spread, I have some powder which, when a UV light shines on it, it glows a bright white. This ball, as you can see, already has some powder on it, and that's representing the germs from where someone else has touched it. When I pick it up, you can see the germs transfer to my hand. Germs living on our hands are not something to worry about, as long as we practice good hand washing and know when we should wash our hands. The NHS tell us to wash our hands after going to the toilet, after playing with our pets or touching their food, after sneezing, coughing or blowing our noses, before eating, and as soon as we get home from being out and about. We've talked about why we should wash our hands, but how do we do it? This may sound like an obvious question, but we don't always wash them properly, and sometimes this can leave germs on our hands. I have special hand cream on my hands that will light up under UV light, like the powder did earlier. I'm going to wash my hands quickly, as if I'm in a rush, with soap and water, but without going through the steps recommended by the NHS. So I'm going to wet my hands, take some soap, give them a good wash, rinse them off, and then give them a good dry. Now, if I shine the UV light onto my hands again, you can see that the cream is still in lots of places on my hands, and this could be where the germs would carry on living if we don't wash our hands properly. The NHS tell us there are 6 steps to washing our hands properly that will remove all the germs from our hands. These are palm to palm, the back of the hands, in between the fingers, the back of the fingers and the nails, the thumbs, and the tips of our fingers. Then we make sure that our hands are completely dry. The NHS have produced a fun video that shows this being done, and there's also a catchy song that you can sing to help remember to wash all the parts of your hands.
This video helps make the proper hand washing technique more memorable for little hands. So wet those hands and apply some soap. It's time for my big song!
Rub the palms, 1, 2. Rub the knuckles, 1, 2. Rub the insides of your fingers and the back of them too. Rub the thumbs, 1, 2. And the nails, 1, 2. Now time to rinse. Happy clean hands for you.
Now we've washed our hands thoroughly, you can see under the UV light that the cream on my hands has gone and my hands are super clean. So I'm ready to have my lunch, knowing that I won't be passing germs from my hand to my mouth. I hope you found this part of the video interesting and will remember all the steps to good hand washing and when we should wash our hands. Thanks for listening. We're now going to learn all about social distancing from school nurse Jade.
Shemai, I'm Jade, a school nurse working in ABUHB in Monmouthshire. Today I'm going to talk to you about social distancing and how to keep safe. Social distancing. Social distancing puts space between people. When people are infected with a virus, it helps not to pass it on to anyone else. By reducing the amount of people a virus is spread to, fewer people get sick at the same time. What are we asked to do while social distancing? Not going out unless necessary, for example, buying food, exercise with household members, and to get medical care. Cinemas, shops, and even your schools had to close during the coronavirus outbreak. You may have also noticed your parents or carers are now working from home. Many people are having to stay at home or work from home. This is to allow fewer people in one area to help reduce the spread of the virus. As Eleanor said earlier, viruses can spread when someone coughs or sneezes out tiny droplets. Even when people talk, these droplets travel out of the mouth. These droplets usually travel further than 2 metres before they fall to the ground. That's the distance of a sofa or a length of a man lying down with a top hat. When you're not seeing your friends and family members outside of your home, it can make us miss them or even feel sad or lonely. There are lots of ways you can keep in touch while social distancing measures are in place. You could get an adult to help you write a letter and post it to your friends. video call friends and family, or draw pictures and save them for when you're able to see them. Keeping safe. To help keep safe against viruses, it is important to regularly and thoroughly clean hands with soap and water, or use a hand sanitizer when soap and water is not available. When outside of your home, keep 2 meters apart from other people. Avoid touching nose, eyes and mouth and general face area. This is to keep any of the virus that may be on surfaces away from your body to reduce the risk of infection. When you cough or sneeze, cover your mouth and nose with a tissue, or if you do not have a tissue, do it in the crease of your arm and make sure you wash your hands after. If you have symptoms of a virus, which include minor coughs, headache or mild fever, it is important to self-isolate by staying at home for 7 days, or if a member of your household has any of the above symptoms, you need to remain at home for 14 days and be symptom-free before you can stop self-isolating.
You might know that schools and shops and other places are starting to reopen. We're just asking you to keep safe and keep up your hand washing and using your hand sanitizer.
Thank you for listening. If you have any questions or would like to speak to a school nurse, you can use our daily contact line. It's open Monday to Friday, 10 a.m. till 2 p.m. Call us on 07 500 124 208 and we'll do our best to help you. Stay safe.